Yes, Rohini. Namaste, Dr. Anandji. Namaste, namaste.
Very good morning, ladies and gentlemen. I appeal for your attention. We are about to begin the virtual inaugural event. I request you to keep your back and neck erect. Let us close our eyes and drop up our mind for a small prayer.
Sahana vavatu sahanau punaktu sahaviryam karavavahai tejasvinavadhitamastu ma vidvishavahai. Om Shanti Shanti Shanti.
This prayer means together we may move, together we may relish. May God protect and nourish all of us. May we work together with the great energy. May our studies be enlightened. May there be no hate among us. My humble namaskara. I welcome you all in this international webinar on yoga for NCDs, a scientific perspective organized by WHO, Collaborating Center, Moraji Desai National Institute of Yoga, Ministry of Ayush, Government Center. Now, may I request Dr. Ishwar Basavaraddi, sir, a visionary mentor and the director, Moraji Desai National Institute of Yoga, New Delhi, to give welcome.
Om Shanti Shanti Shanti. Today's chief guest, respected Dr. Kim Sung Chol, and guest of honor, Shri Bikram Singh Ji, Director Ayush, and my esteemed yoga colleague and Dr. Eminent Yoga expert, Dr. Anand Balyogi Ji, and all my participating friends and my colleagues in the institute. My hearty welcome to you all. At the outset, it's a great pleasure to
on.
okay.
Bluetooth mode.
Just
Connected.
I also noticed the presence of our senior mentor, Dr. Madan Mohanji. Welcome to you, sir. It's a great honor to just introduce our today's guests and also welcome to you all. First of all, our today's chief guest, Dr. Kim Sung Chol, is the regional advisor in traditional medicine (TRM) in WHO CRO, and he is the instrumental in bringing us the WHO Collaborative Center Traditional Medicine Yoga. This is the third consecutive term. Each term consists of 4 years. He is basically a Korean medicine expert. During last more than 5-6 years, he has flourished the entire traditional medicine and its integration with the modern medicine system, and is very kind enough to guide us in all our endeavors in the WHOCC. Most importantly, in the work of meta-analysis, because a lot of researches are being conducted across the globe. There is a need to bring the analysis and also content to the. Please unmute others. Unmute, sir. बाकी लोग unmute कीजिए, please. Please unmute. Thank you. So this is a very important work where, with his expertise view, this collaborative center and this especially this international webinar on yoga for non-communicable diseases, a scientific perspective is being connected. Welcome you, Dr. Kim Singh Chol. Hearty welcome to you.
Okay, thank you.
Thank you. And
Dear Shri Vikram Singh, Director of the Ministry of Ayush, Government of India, and dear Dr. Madan Mohan, Director, Center of the Yogic Science, AB Medical College, Pondicherry, and dear Dr. Ishwar Basavaraddi, Director of the Moraji Nursery National Institute of Yoga, under the Ministry of Ayush. And distinguished participants and ladies and gentlemen, a very good morning. First of all, I'd like to congratulate Moraji Nursery National Institute of Yoga for their successful organization of this important international capacity building workshop. So as you know that the Moraji Nursery National Institute of Yoga is one of the WHO Collaborating Center for Traditional Medicine. And as a WHO Collaborating Center, in recent years, the institution has made significant achievement in promoting the evidence-based yoga practice by developing training modules on yoga for NCD and undertaking systematic meta-analysis on the research in the yoga, and also participating in the development of WHO benchmark for practicing in the yoga and so on. And so this achievement has greater contribution to the health promotion and disease prevention and management at the international level. So regular and adequate physical activity is so crucial to lifelong physical and mental health. Physical activity promotes blood and oxygen flow, bones and energy, and help to enhance mental well-being, which is all essential to reducing the risk of the non-communicable diseases. It also builds immunity and strengthens the body's response to the communicable diseases. Insufficient physical activity is one of the leading risk factors for NCDs and their related deaths. In WHO Southeast Asia region alone, NCD causes around 8.5 million deaths every year, and many of them are premature deaths. And according to a study, the children aged 5 to 17 require at least 60 minutes of the moderate to vigorous physical activity daily, and adults aged 18 to 65 need 150 to 300 minutes of the moderate physical activity weekly. Older people aged 65 and above require at least 100 minutes of the moderate physical activity every week. In recent years, efforts to promote the physical activity, including yoga, have gathered pace across the region, in line with the region's flagship priority on preventing and controlling NCD, for which high impact and cost-effective best buy are key. So all member countries have incorporated specific point on the promotion of the physical activity into the national multi-sectoral NCD action plans and implement the innovative measures to promote physical activity in schools, workplace, and public spaces. All member countries have committed to achieving the global target of reducing physical inactivity by 10% by 2025 and 15% by 2030, for which they are leveraging Global Action Plan on Physical Activity 2018 to 2030 and its active toolkits. The impact of the COVID-19 underscores the importance of promoting good health throughout the life course. Though all people can be infected by COVID-19, the risk of becoming severely ill increases for those people with a pre-existing NCD, including cardiovascular diseases, chronic respiratory disorder, diabetes, and cancer, and also among older people. Yoga can help people to lose weight, relieve stress, and improve immunity, and maintain a healthier lifestyle through combined physical and mental exercise by applying different postures and meditation. Yoga is a powerful way for all people to get the physical activity they require to reduce the risk of the NCD and enhance mental well-being, as a yoga can be practiced by all age groups, anywhere, and at any time, irrespective of their social economic status. So I'm very confident that today's capacity building workshop will further complement WHO's effort to leverage yoga practice as a preventive and promotive health interventions against the COVID, against the NCD. So I hope all the participants having a better understanding on the scientific evidence-based benefit of the yoga practice through these workshops. So with this, I wish the workshop great success. Thank you.
Thank you, Dr. Kim, for your esteemed presence and a very authoritative and also guiding words for the entire participants and especially the institution CC officials. Now, before inviting my colleague in the ministry, Sri Vikram Singh, it's my privilege to introduce him. Vikram Singh is a 2001 batch Central Power Engineering Service cadre officer. He's basically an electrical engineer and an executive MBA degree holder. And as you know, he worked in different ministries. During last 2 years, he is working as a director in the Ministry of Ayush and looking after yoga, naturopathy. And he is our esteemed colleague. And we are working together for the promotion of yoga and naturopathy, especially in the International Day of Yoga. Many initiatives we have taken in the ministry promote yoga. In the WHOCC also, several activities has been initiated by the institute, where Sri Ranjit Kumar sir, our joint secretary, our secretary Sri Rajesh Kotejji, Vaid Rajesh Kotejji, and Vikram Singh ji always stand like a backbone to us, help us to. With these few words, it's my privilege to invite Sri Vikram Chingri, a guest of honor today's lecture. Sri Vikram Singh ji.
Namaskar. Respected Dr. Kim Senggi Chol, Dr. Ishwar Basavaraddi ji, Dr. Anand Balayogi ji, Dr. Madan Mohan ji, scientists, scholars, WHO representatives, students. The ancient wisdom says, health is a prerequisite for the happiness. No incident bigger than today's COVID-19 pandemic could teach us bigger lesson of physical and mental well-being. Patanjali in 200 BC said, when you are inspired by some great purpose, some extraordinary project, all your thoughts break their bond. Your mind transcends limitations. Your consciousness expands in every direction, and you find yourself in a new, great, and wonderful world. Dormant forces, faculties, and talent became alive, and you discover yourself to be a greater person, far better than you ever dreamed yourself to be. Yoga is one of the ancient wisdom which can transform ordinary to extraordinary, disease to vigor, and instability to harmony. However, fruits of yoga lies in the regular practice of yoga. We all know that by its resolution on 11th December 2014, the United Nations General Assembly recognized that yoga provides a holistic approach to health and well-being and appealed for wider dissemination for information about the benefits and practicing of yoga for health of the world population. Observation of International Day of Yoga is a small step to demonstrate the benefit of yoga to one and all. Honorable Prime Minister of India himself leads the nation, and he has been doing so since last 6 years of declaration of IDY by the United Nations General Assembly. Ministry of Ayush acts as a thread of the government of stakeholders to fulfill the objectives of the United Nations resolution. This webinar, Yoga for Non-Communicable Disease, a scientific perspective, is reassurance of what is already known about yoga. I wish all the success of this webinar of capacity building, which is very much required. Thank you very much for inviting me here. Thank you.
Thank you, Shri Vikram Singh ji, for your esteemed presence and also very guiding words. And before I invite some of our resource persons, let me give a what we are going to do. So in the next 5 days, uh, we have a 2 practical sessions every day and 2 theoretical sessions. 18 experts from different fields. They are going to deliver lectures and also conduct the practical sessions. And first day we'll have a cardiac care or cardiovascular disorders. Tomorrow on 27th we have respiratory disorders, yogic management, prevention and management aspect. Third day we'll discuss on yoga for cancer care. Fourth day for diabetes, and the last day we'll discuss on mental health, yoga for mental health. As you know, more than nearly 79% of deaths are because of non-communicable diseases, and 44% on the cardiovascular diseases, and 9% on the COPD, and 22% on cancer, and 4% on diabetes. So therefore, it is a high time where all the entire world is on the communicable diseases we are talking about, but actually the major deaths are caused because of the non-communicable diseases. In the last 4 years, Institute has taken several measures and developed 5 protocols. Every day, 12:30 to 1:30, we will have a practical demonstration and also discuss all these protocols based on the evidences and with the expert suggestions we have developed. Now they are in the, we are going to publish, give it in the public domain for the wider discussion, so that by next few weeks we can come up with these modules and submit to the WHO. That is the one of the objective of this capacity building. Then second one is many professionals in this one. 13 international participants and 30 national participants are participating. So all of them are medical professional and yoga professionals who are doing the research, completing their master degree and doing the PhD or have done some PhD. So everybody is having minimum 5 years to 15 years of experience in their relevant fields. So our aim is to educate them and integrate yoga in all medical systems, not only in modern medicine, in also in Ayush systems. And if you go to the, I went to North Korea, Dr. Kim Sung-chol is knowing about, and very meaningful integration I have found. Twice I visited, and very meaningful integration of traditional medicine and modern medicine I have noticed. Therefore, in India, also in other CRO countries, it's very much essential, especially Nepal, Bangladesh, Myanmar, Sri Lanka, my colleagues are joined. It is very necessary to integrate the modern medical system and this thing. That's why this capacity building workshop is one of the important initiative of our WHOCC in this regard. With these few remarks, and I invite Dr. Anand Balyogiji, just a few, say a few words before your mentor will start. Dr. Anand Balyogiji, he is one of the leading yoga researcher and comes from a very traditional yoga family. And tomorrow we have a lecture and I will introduce in detail because of shortage of time. And he's always very receptive and also listen whenever we call. He's ready made with his presentation. Dr. Anand Balyogiji.
Namaste Ji. My hearty congratulations to the WHO Collaborative Center at Moraji Desai National Institute of Yoga for organizing this international capacity building program on yoga for non-communicable diseases. It is a pleasure to see Dr. Kim again. I remember meeting at one of our events at MDNIY earlier, and your support for this collaborative center and bringing evidence-based yoga into the modern medical system is much appreciated, sir. And our director in Ayush, Vikram Singh ji. Such a pleasure to be with you here today. This is the need of the hour, because non-communicable diseases, when yoga is brought as integrative management with modern medical system, in what today is called traditional complementary integrative medicine. The old name was CAM, complementary alternative medicine. Today it is traditional complementary integrative medicine, and the WHO is focusing on this. So the role played by MDNIY, headed by my dear and most respected Basavaraddi sir, you are an amazing human being. You are a true yogi who's standing up for yoga and taking it in the right direction. We all appreciate the work being done at MDNIY through this collaborative center. We thank WHO for making this possible. We thank the Ministry of Ayush for its wonderful support for the system of yoga. And with this, on behalf of the yoga community, I offer my felicitations on the occasion of this event. Let it be a grand success with the grace of the yoga masters, the timeless rishis of Bharata Varsha. Namaste, Dhanyavadaha.
Thank you, Dr. Anandji. It's now time to introduce our mentor, senior researcher, and very good friend of all of our family member and friend, senior friend, mentor, everything. Many phrases we can use to our most beloved Dr. Madan Mohanji. He is a emerite professor of physiology and director, Center for Yoga Sciences, AV Medical College and Hospital, Pondicherry. Before that, he has more than 40 years of service in the JIPMER, a very premier medical institute, as professor and director professor and head of the Department of Physiology. Most importantly, and he is the instrumental in starting the yoga research more than 5 decades back. And Dr. Anandji is one of his product and proud student of Dr. Madan Mohanji, and I am also blessed under his guidance. When we started this meta-analysis concept, Dr. Bholeji and Dr. Madan Mohanji are the two experts who have helped us, and always they are ready to give their guidance. Unfortunately, in the just few weeks back, we lost our beloved Dr. Bholeji, and that gap with the presence of Dr. Madan Mohanji, now he has a greater role to guide us, because he is the one of the senior most hundreds, more than 100 research papers are there to his credit, especially on particularly on yoga, yoga therapy, cardiovascular disorders, etc. With a short notice, when we requested, Dr. Madan Mohanji has agreed to our request and present, and he is going to deliver a full 1 hour lecture, but in the inaugural, just a few words for his blessing. It's my privilege to welcome and invite Dr. Madan Mohanji. Dr. Madan Mohanji, sir. Welcome.
Thank you, sir, very much. I am audible.
Yes, sir. Yes, sir.
Thank you very much for giving me an opportunity to be part of this. It's a pleasure and privilege to be part of this wonderful program, webinar, international webinar on the non-communicable diseases. We are aware that non-communicable diseases, they impose more than 65% of burden on our healthcare delivery system. And in advanced countries also, and developing countries also. And the incidence of these non-communicable diseases is increasing slowly, year by year. And we know modern medicine is not able to cure them completely, especially when they have gone beyond in advanced stages. And yoga has capacity to stem the onset as well as progress of these non-communicable diseases. And so you have organized this webinar. I congratulate you and your team to organize this program. And I feel very much privileged to be part of this. And now yoga has capacity to Yoga is not an alternative system, as has been already told. It's a complementary system. It can complement the modern medicine. It can enable it. It can ennoble it also. So because the holy science. So that modern medicine instead of becoming being a purely materialistic, it becomes also holistic and also spiritual aspect. It is able to deliver the Medicare to patients who have got this chronic disease for the whole lifelong they suffer. And the initial stages, yoga can stem the disease, almost cure in the beginning. Later stages also, it can improve the quality of life, reduce the drug dosage, and also drug dosage is reduced so that the budget is improved and also side effects of the drugs are also avoided to a great extent. And therefore, this webinar is very much relevant, timely, and I again congratulate you for organizing this webinar. And we hope that the participants will be benefited by this program. Thank you very much.
Thank you, sir, for your kind words. Am I audible, sir? Am I audible?
Yes.
Yes, because some network issue. And sir, just thank you very much for your kind words. Before I hand over the this one to our colleague, I notice my presence of Dr. Ilan Chalian, who is the program coordinator of WHOCC. Last 2 weeks back, he got COVID positive and he was in home isolation, but still he and Lakshmi has did a wonderful, remarkable job, because last 15 days are not a easy, they are not easy going, very difficult in many places. Under the odd circumstances, Dr. Lakshmi Kandan and Dr. Ilan Chajan and Sri Rishi did a wonderful job in organizing this webinar. So with these a few remarks, just to inform before I hand over to Rohini, we have more than 5,175 peer-reviewed research articles, published articles in the peer-reviewed journal in the last 16 years, from 2006 to 2021 March. On meditation, we have more than 6,135 papers are available. So we have done a meta-analysis on all of this, on the papers, on cancer care, cardiovascular diseases, respiratory disorders, diabetes, and also mental health. In the next 5 days, definitely we are going to listen to our expert, and also we are going to present all these research findings so that the entire group who are participating in these things so will be benefited. Thank you very much. Over to Rohini.
Thank you, sir. Now, may I request Dr. Lakshmi Kandan, sir, to give vote of thanks. Sir.
Namaste to all. It is my privilege to have been asked to propose a vote of thanks on this occasion. We are really indebted to Dr. Kim Sanchal, Regional Advisor, Traditional Medicine, WHO 0, for taking his previous time to grace this international webinar cum workshop and share with us his views and opinions aimed at larger benefits of research professionals and practitioners of yoga. Sri Vikram Singh Sir, Director, Ministry of Ayush, Government of India, has always been a master of words. To him, our sincere thanks. This workshop would not have been possible without the support and guidance of our Secretary, Sir, and Joint Secretary, Sir. To them, my deepest thanks. I also thank to the entire 18 resource persons who have agreed to act as the resource person for this international workshop cum webinar. And I also thank all the participants attending this program and hope that this webinar proves to be helpful, enriching, and enlightening for you. I also thank my director, Dr. I.V. Basavaraddi sir, for his contributions, guidance, and support in conducting this international webinar cum workshop. Last but not least, I would like to thank all the institute members for successful organization of this workshop. Thank you.
Thank you, sir. Now we are here at the end of the opening ceremony. Next, we'll begin the next session within few minutes.
Thank you. Om Shanti Shanti Shanti. Thank you very much. The inaugural